Welcome to Break the Needle. I'm your host, Adam Zivo, and I'm here to tackle Canada's problems with addiction and crime. Today, we're going to discuss the push to destigmatize drugs and the consequences it has had on North American communities. Here to join us is Keith Humphreys, a professor at Stanford University who has distinguished himself as one of North America's leading drug policy experts. In late 2023, Keith co authored an influential essay for The Atlantic titled Destigmatizing Drug Use Has Been a Profound Mistake. So, we're going to dive into his arguments and understand how this mistake was made and what can be improved going forward. Thanks for joining us, Keith.
We're really glad to be on the show again, Adam.
Now, first of all, can you explain to us what does it mean to destigmatize drugs? What are the exact goals here?
Yeah. So what we used as our kickoff point was a remarkable thing that happened in San Francisco City, right next to where I live, that the public health department put up billboards showing attractive, successful-looking people using fentanyl together, and it said fentanyl, do it with friends. And they looked a lot like beer commercials or tobacco commercials, but that's not what they were. Now, their logic was, if we take away the stigma, if we stop people feeling bad about fentanyl, stop making such a big deal about fentanyl, then people will be more comfortable admitting they're using it together. And then when someone overdoses, there'll be someone there to save them. It's more likely. So that was the reasoning. But the more
Hmm.
extraordinary thing to me was that if a beer company had done that, put billboards up all over the city glamorizing beer, the public health department would have yelled at them, and the mayor would have yelled at them, saying, "You're giving the wrong message. Children walk by those signs. There are risks to alcohol that you are understating, all that sort of stuff." But no, that it was just the opposite. Public health's position saying, "Let's stop having all these hangups about it." Around that same time, there was a famous hot mic moment from someone high up in city government who said, to a group of grantees of the city, if you have a problem watching people use drugs, deal drugs, that then there's something wrong with you. That's really your problem. It's nothing wrong with them. And that again expressed this, sort of mentality which was dominant at that time.
Okay, but for those who advocated for drug destigmatization, they had this hypothesis that it would help people feel more comfortable seeking treatment. But did they have any evidence to back this hypothesis, or was this evidence-free policymaking?
Yeah, it was actually the opposite of evidence. So yeah, the idea was that people voluntarily really, really want to come in, and it's just this, stigma that is stopping them from doing it. Now, there may be individuals like that. I mean, and I'm sure there are, but the evidence overwhelmingly across all addictions is that most people come to treatment because they've been disapproved of, because they're being pressured by their family, by employers, by friends, by the community. So when you take away all pressure, and that was coupled, of course, with taking away any legal pressure, because these places were also decriminalizing drugs at the same time. No, nobody came to treatment. Why should they? Drug use feels good. Treatment is hard work without any press to do it. A lot of people said, "Oh, I'm just going to keep using drugs."
Okay, so between these two competing schools, we had the pro stigma side, which was backed by copious amounts of research that went back for decades. And then we had the destigmatization side, which was basically just a hypothesis that someone came up with that sounded nice to these leftist libertarians who thought that drug use should be unimpeded. And they really had no evidence to back this position at all. So, if this is the case, then how was it able to get so much traction within San Francisco? I mean, it seems inexplicable.
Yeah, it's a great question. I mean, and to be clear, this really got a particular region. So with San Francisco, but also Oregon, Washington, British Columbia, up where you on, all had variations of this idea. We have to remember the time. This was right after the murder of George Floyd by policemen. There was a real anti-police sentiment that swept the country, and people were justifiably upset, angry about the murder of George Floyd and police brutality in general. So there was that. There was also a pandemic on. And, there was a level of emotion about many issues, people online all day screaming at each other. Politics got very volatile. And so these ideas, which normally I think would have been considered pretty fringy, in that particular environment, in a particular region, were able to become the mainstream, at least briefly.
Okay, so we had a period of political insanity in the early 2020s where many questionable policies were pushed through. And as a result, we had this brief period of destigmatization that proved disastrous. When we get back from the break, we'll talk about what destigmatization looked like in practice at a concrete level. And we're back with drug policy expert and Stanford professor Keith Humphreys discussing why drug destigmatization was a bad idea. Now, before we went to break, you mentioned that drug destigmatization in the context of the United States, was epitomized by this billboard in San Francisco where they had a whole bunch of healthy, happy-looking people, presumably doing fentanyl together, and it said "Do fentanyl with friends." And there was a hot mic moment where a high-level official in the city was caught saying that if you feel uncomfortable seeing someone do drugs, then you're the problem. So these are two, evocative examples, but they're only two anecdotes. At a grander level, what did destigmatization look like, for example, in terms of public health messaging, changes in what kind of interventions were funded, shifts away from recovery oriented care? What were the systemic outcomes here?
Yeah, that's a good question. Because policy is always bigger than anecdotes. So if you look not too far north of San Francisco, Oregon and Washington State, both, decriminalized drug use in public as well as in private, and to a large extent decriminalized dealing drugs as well, and counted on a system of entirely voluntarily treatment seeking and redirected money away from treatment and much more into harm reduction services. British Columbia did, a similar kind of decriminalization experiment, again, in private or in public. So you could use out, if someone wanted to use the park and you were using drugs, that which you were right. And at the same time, started giving away drugs, which is the sort of ultimate expression of this view is not just the government's place to or no, not at least you got to not be trying to stop or in any way, stigmatize drug use. It should be facilitating it actively. And so they began giving out hydromorphone, which is a quite powerful opioid, to people who wanted to use it in any way they could. Not this is not like methadone where you're watching them in the clinic or anything, but actually just giving them prescriptions and saying, go ahead and use that. You're right. And as that spread, there were significant consequences for neighborhoods, for communities, for overdose rates, I think it was those things, those costs, that over time pushed the political discussion from sort of embracing this in a very emotional period to um, ending up turning fairly decisively against it.
Mhm. And from my understanding, this focus on drug destigmatization, when it was at its apex, was so radical that conversations around recovery and abstinence were discouraged because they were seen as offensive to drug users and offensive to public health experts who believed that any criticism of drug use was inherently harmful.
Yeah. So there's a camp within, clearly not all people who do harm reduction think this at all, but certainly there's a camp within who see treatment as kind of like moralistic, judgmental. If I'm referring someone to treatment, aren't I in a way saying they shouldn't be using drugs? Who am I to say that? That's not my job. Even though a lot of harm reduction is sold to the public and to taxpayers and politicians as this is our pathway to treatment, a number of people in that movement don't really believe in those things. And so it was a sad time for that kind of work. Oregon's a really good example because Oregon had a treatment system. They passed Measure 110, which allowed a lot of new funds to go into treatment, but they didn't put it there. They promised they were going to put it there, but instead it went to a board that was overseen by friends of the people who had passed this measure, and almost all of it went to harm reduction. And when questioned later, one of the people who led it, was quoted in the paper, said, "Well, the people of Oregon thought you were going to build treatment." She goes, "No, no, no. Money's going where it's supposed to." In other words, this was a con job, but uh, at that point they had control and were able to, sort of defund the old treatment system and fund the services that they felt fit with their ideological preferences.
Would it be fair to say that there was an element of profiteering, if not corruption, in this transformation, and that you had a group of harm reduction activists who then redirected money to themselves and their friends at the expense of recovery oriented services?
I don't know. Corruption's a pretty strong word. Probably people being dishonest. My sense of the people who did this actually was that they were sincere. They really did believe this. So it wasn't, I want to do this because, I want to make myself rich. I think they were living out a certain perspective on drugs, a certain perspective on the role of the state, that was sincere here. I happen to think it was wrong, but I don't question that they truly believed it, and genuinely thought it would work.
It's sad because these people did want to save lives, many of them, but unfortunately, they were so lost in their ideology that they end up harming the very people who they had hoped to help. Now, when we get back from the commercial break, we're going to talk about the relationship between the American US policy space and the Canadian one and how they influence each other. And we're back with drug policy expert Keith Humphreys. Now, before we went to break, we spoke about the shifting dynamics of the harm reduction and recovery oriented movement in the United States and how the push to destigmatize drugs stalled and is now being reversed. Now, of course, break the needle. We're a Canadian TV show. I want to hear about the relationship between the American policy context and the Canadian one. We know, for example, that Vancouver is seen as sort of a beacon of the harm reduction movement, and it influences, North American policy, including U.S. policy. And then San Francisco, of course, has its influence on Canadian policy to a certain extent. But can you help us better understand the nuances of this reciprocal relationship?
Yeah, British Columbia is, probably the most harm reduction forward, decriminalization forward part on the planet, really. And Vancouver, the people have been active there now for 20 years, have had a huge influence on many people in American public health, American medicine, including a lot of people who trained there and then, went to work back in the United States and brought those ideas with them. And but some of those ideas were reasonable. I said we're treating people with dignity. I mean, certainly in favor of that. Giving people health care. I'm certainly in favor of that. That makes sense. But I think there should have been more caution of taking so much advice from a region that has had through this whole time one of the highest drug death rates on earth. And that never seems to, change the confidence that this is the right way to go. I mean, why not take advice more from places that have much less severe drug problems as opposed to more? But that never really seemed to enter into the calculus. And that,
Hmm.
I think, and you could see the mirroring. And there were even people in Washington State, for example, which of course is next to British Columbia, who were saying we need to be. Look what they're doing in British Columbia. They're ahead of us. They're giving away hydromorphone. We need to start giving away drugs too. So that influence is definitely there.
Well, and how much collaboration is there between Canadian and American drug policy activists in this space? Are they merely inspired by one another, or do they meet up and exchange ideas and try to collaboratively work for a continental wide shift?
Yeah, well, of course, the internet's changed everything, right? So you can have huge, and there are huge communities online of people with all kinds of views, on all kinds of matters, exchanging ideas all the time. And then the pandemic, while this was happening, people were inside an awful lot, spending a lot of time online. So there were a lot of exchanges that way, a lot of discussions that way. That definitely happens. And to be candid too, I talked to Canadian policymakers myself. Probably talked to, I don't know, six or seven provinces at some point or another have called, and I speak to them too. We are neighbors, we're historically friends and allies, and so those exchanges in principle, are good, right? We could try to work together, deal with these shared challenges. But I think the internet accelerates in part because you can form like-minded groups online or on your social media or whatever, where your views are actually representative of only 10 or 20%, but you think they are 90% popular, and you can just bully the remaining people there. And then when that doesn't work, you get madder and madder, and that dynamic can happen to anybody on any political issue. It probably happened here to some extent.
And then segueing from that, when you wrote your essay for The Atlantic on why destigmatization is a really bad idea, what response did you see from that? And were you nervous before it was published?
Um, the response was overwhelmingly positive. Lots and lots of people wrote me and said, "Thank you. This is what I've been thinking. I feel like I've been silenced and I'm not allowed to say that I think fentanyl use is bad, not good." that I think we should tell our kids, don't do that. It is not just like a, another activity. It's in fact something I really, really don't want you to do. It's a big, big mistake. I mean, things you think would just be rational. I remember at one point there was a temporary supervised consumption site in San Francisco, just to give you a sense of the environment in 2020. And I said to a TV reporter, well, they're supposed to be referring people to treatment. I wouldn't have somebody smoking fentanyl next to somebody standing in line waiting for treatment. And the reporter said, "Would you be willing to say that on television?" Just
Mhm.
like, well, of course I'd be willing to say it on television. That's just common sense. But it was seen as, at that time, just outrageous. Did get some hate mail, absolutely. Couple places, where I've spoken, some people have gotten kind of mad and complained and all that. But I'm more struck by the overwhelmingly positive response, to the
Mhm.
things I said. I think it was just saying things a lot of people were thinking.
Which would suggest that the destigmatization movement was in some sense just kind of like an astroturf movement, right? There was a false consensus that didn't actually exist, and most people saw that this was not going to work out and that it wasn't wise to destigmatize drugs like fentanyl and meth. But we'll get back to this after the break. And we're back for a conversation on why destigmatizing drugs is a bad idea. Now, what I find really interesting is that at the height of the destigmatization movement in the early 2020s, overdoses and deaths only continued to skyrocket. And there was a lot of misery that we saw on the streets of Vancouver, of San Francisco, of many smaller cities in the United States and Canada as well. But recently, we've begun to see a precipitous decline in overdoses and deaths that coincides with the shift towards a more conservative approach to drug policy. That being said, you've recently published a paper that, from my understanding, cautions people not to overinterpret this and focuses on the supply of drugs and argues that it's not about stigmatization that is driving this decline, or at least not totally, but it's more about, factors in terms of like what's available for people to purchase.
Right. So this study, which was done in collaboration with researchers at Carnegie Mellon, the University of Maryland, and United Nations Office on Drugs and Crime, looked at why is it that starting in the middle of 2023 in both Canada and the United States, overdoses started to drop, and not just a little. I mean, they really, after years of going up, were dropping really, really steeply, and we follow it for at least an 18-month drop and perhaps longer. And what we show in that paper is there was a change in the drug supply. Fentanyl powder and pills became dramatically less potent. Less potent drugs are going to mean fewer overdoses. We also looked at Reddit discussions of people who use drugs, all and noticed these huge spikes in people talking about shortages, weaker drugs, more withdrawal, all that kind of stuff. So users were also reporting this. And what we trace this to probably is supply control in China. And the reason we say that is there's a difference between the American and the Canadian fentanyl market. Fentanyl gangs in Canada get their precursor chemicals from China and make their own fentanyl. But in the US, those precursor chemicals go to Mexico and then they are processed and shipped up into the United States. So if it had been a Mexican intervention, well, some Mexican policy or US law enforcement action with the Mexican government, it would have affected us, but not Canada. But the fact that it affected both suggested something upstream, and the most likely candidate there is China. And this is to return to what we were talking about before about the idea of, you know, decriminalize, pull back, let's just approve, stop being so judgmental and all that. With that had come a hostility to law enforcement and any type of supply control. And here, what this study shows and what our experience shows is a supply control intervention just saved tens of thousands of lives. So it is crazy to say this is not part of the solution to drug problems.
And I just want to clarify, do we know what this intervention was? Because from my understanding, the United States did pressure China to clamp down on its fentanyl exports in the late 2010s, after which point China switched to shipping out precursors so that, Canadian gang members and Mexican gang members could synthesize fentanyl themselves. But do we have any indication that China has clamped down on precursor exports as well recently?
Yeah, yeah. So you're right. I mean, this is something that China and the U.S. have been going back and forth on since fentanyl first appeared. And sometimes, of course, our relationship with China has been bad, sometimes good. So it's varied what they've done. But in 2023, they started doing things like shutting down websites, warning companies, scheduling various chemicals, and then President Xi and President Biden signed an agreement that China would commit to all further activities suppressing fem trade in late 2023. So they clearly have been active on this front, and if they stay active, and let's hope they do, that could mean continued drops for both the U.S. and for Canada, which obviously would be a terrific thing.
Okay, so then in just our last 30 seconds, what is the key message that you want our viewers to walk away with from this conversation?
We went through a very unusual period where we pursued some policies that just didn't work, and we need to return to the realities that drugs are dangerous, people who are addicted need and deserve treatment, and that in the end, our goal should not just be keeping somebody alive for another 24 hours. It should be to get them into recovery. That's the best for them, and that is also the best for the families, for the communities, and for our countries.
Wonderful. Well, thank you for joining us on the show today, Keith.
Really nice to see you again. Thanks for having me.
I think most Canadians can understand at an intuitive level that destigmatizing drugs is bad. People shouldn't be allowed to just use fentanyl and heroin willy nilly. But unfortunately, in the early 2020s, there was a brief period of insanity where people thought the opposite. Now, life is returning to more normal and lives are being saved, and hopefully, this trend will continue.